Ashley Moultrie. I am the Director of Clinical Operations for Javara. I cover all of North Carolina for our team. I have worked in clinical research a little over 10 years now. I fell into research on accident, but I stayed on purpose. I started out as an undergraduate research assistant at the Medical University of South Carolina. It was, a work study job. It seemed interesting. And while there, I worked on a medication adherence program. And it became overwhelmingly obvious very quickly that my patients weren't adhering to medications because they couldn't afford medications. And so I made it kind of my business to find them as much, free drug opportunities or reduced cost opportunities as humanly possible. And in that search, clinical trials, industry-sponsored clinical trials kind of became the go-to. Me being me, I'm not going to offer anything to my patients that I haven't vetted. So I did a little bit more digging in the trials and in the industry as a whole. And it became even more apparent that there was a massive unmet need. One, to connect, patients to trials, but also to connect patients and their providers to these opportunities. As a minority woman in leadership, it's something I can't separate the two. My experience has been affected by both. And so with that, some of my largest challenges, of course, as I'm sure other women have had, is sexism and racism. They, for some reason, have gone hand in hand. And while overt sexism and racism have always been a thing, it doesn't happen very often, right? When people are just blatantly sexist or racist. When that happens, you kind of regroup and move on about your day. The biggest challenge has been those microaggressions that every day, several times a day, things that kind of chip away at your womanhood, or for me, my Blackness, and, invalidate my experiences as a woman and an African-American woman in lots of spaces, unfortunately. And I've learned that, you don't necessarily overcome it as a collective, right? That work isn't on me to get people to see my value and value my opinions and my experiences. And more so you overcome it situationally. I make sure I connect myself to and align myself with people, places, things, and organizations that are committed to DEI, that understand my difference is what makes me valuable. My message to those patients is that we're going to do better as an industry. Right now, there's this massive call to action for minority patients to sign up for clinical trials, right? Well, the industry, until recent strides, hasn't made itself or lent itself to our involvement. And I say our as a patient myself. And so as an industry, being a part of this industry, I want, those patients to know we are doing better. We are working on increasing our dissemination of information, making clinical trial options more accessible for you, and increasing the transparency in the process. Without those three things, the massive distrust that has been built in our communities, it's not going to just disappear, right? And even though myself, I wasn't necessarily a part of creating that distrust, as a member of the industry, I'm going to make it my business to make sure I can fix that. Go for it. Join, take the class, join the teams, do the seminars, and don't take no for an answer.